Now coming straight back to the webinar.
Yep.
Actually, it has been explained in detail, the reason why we are having it and the context in which we are sitting and talking to each other at the moment. And the context is the worldwide pandemic, the corona pandemic, and being the largest democracy and the second most populous country in the world, India has its very crucial role to play right now and also in future. So this is a crisis of a lifetime, the battle of a lifetime for all of us, not just for our survival, but also for our shaping the destiny of future. So I would like to begin by inviting Dr. Kalyan Banerjee. But before I invite Dr. Kalyan Banerjee, I would like to quote the first shlok of Gita, because the first biggest crisis that humanity had ever faced resulted in the battle of Mahabharata. And even the best of the strategies were challenged when at the onset, even before the Mahabharata battle started, the most valiant of the warriors had his doubts, Arjun. And that is how the Gita came up, the Krishna and Arjun conversation. And in the first loka, Dhritarashtravacha, Dharm Kshetre Kurukshetre Samveta Yujutsava Mamka Pandavaschaiva Kim Kurvata Sanjaya. Dhritarashtra asks Sanjay, and in Dharm Kshetra Kurukshetra, two armies are facing each other. One is that of the Pandavas, the other of my sons, Kauravas. Dear Sanjay, what has happened? Please tell me. There is a reason. And the rest of the 700 shlokas, most of it in the conversation between Arjuna and Krishna, completes the Gita. The reason why I'm quoting this first shlok of Gita is, at the moment also, there is as big a battle, if not bigger, than Mahabharata. The two armies, the negativity of Corona army and the positivity of us, which is embattling the Corona, is here. And the reason for this particular webinar is to find a proper strategy for future, how to emerge victorious as the Pandavas emerged victorious in the battle of Kurukshetra. So, to start this webinar, it's my proud privilege to invite Dr. Kalyan Banerjee, who, for record, has been director of National Institute of Virology, Pune, nearly 3 decades back. But at the moment, he is a Bhishma Pitama in the field of immunology, virology, epidemiology, and the other related healthcare issues. So please welcome the Bhishma Pitama of healthcare of our country and the world, the most eminent of the persons in the healthcare, Dr. Kalyan Banerjee. Now, I invite him to share his views of the present corona crisis and the way forward for future. Dr. Kalyan Banerjee, please.
Sir, thank you very much for saying so many good things about me, which I really don't deserve.
Thank you. You deserve it, sir.
Sir, the question is that about this, if it is specifically to the coronavirus, I can say that I have never worked with coronaviruses. I have worked with Japanese encephalitis, several dengue, chikungunya, hepatitis, HIV, Smallpox, and so many things. But coronaviruses, we always thought that it is a variety of common cold virus. So let's skip over it because there are many more pressing problems with us. But now it has come out as a, what I would say, a global problem. The question is that how a virus can become a global problem. A virus, as you know, is basically a chemical or assembly of chemicals. There is a central core of RNA or DNA, then there is a protein coat, and then sometimes they have a lipid coat, things like that. Now, it has got two lives. One is a concentration of chemical, which is a dead thing, and one is in the cell, which is a living thing. It is partly living and partly dead. Now, it is how the living portion within the cell is responsible for the damages or good things or bad things done to the body of the host. And the chemical part that goes out to infect or to go to another host, that is an inert part. Now that we have to see both these points separately. Now there are several points before that. Professor Haldar has said that we are interested in not only fighting, and of course Dr. Mr. Sharma said about the fighting between the corona and the world and this and that. It is really not a fight between two armies. It is between an inanimate animate object and the host and the living organisms. It is a fight between living and dead. So we'll have to see that the living things live and dead things remain dead. The question arises, how do we do that? When a virus, I'm not talking of coronavirus, I'm talking of a virus in general. It has multiplied itself within the body of the host. It has done its damage or good or bad or whatever is that, and it comes out. It has to find out another host. And to get the another host, it has to go through either through touch or body or air or water or to or some insects. Hello?
Uh, yes, sir, Dr. Banerjee, you can continue. There were some disturbances, but you can ignore them, please.
Okay, no problem.
And this is Kumar Rajesh, sir. Dinesh Banerjee, my co-host, will take over after 1 hour.
Right, sir.
Okay, thank you.
So the virus has to make itself adjustable to different circumstances, and the host also has to see its defense from the different sources. Now there is a very famous epidemiologist from Russia. Well, his name is Pavlovsky. Pavlovsky was the Russian epidemiologist and virologist also, who initiated the natural nidality of virus infections, which means that a virus or an organism has to maintain itself within its natural nidus. Nidus means a nest. What is the nest? That it is circumstances or the immediate conditions in which it can persist itself without too much damaging the host. How the when it passes out of this natural nidus or the natural circumstances, it goes into a new area. It can create either damage to itself or damage to the host infinitely. So, for example, there are many examples in virology and also in microbiology that the natural cycle of the organism gets disrupted or changed due to certain interventions. When the human interventions are not there, they remain within themselves and they kill them, and they kill or maim or do a little damage to the host. One should realize that it is not the interest of the organism or the host virus or microorganism to kill the host. If it does, it also dies itself the host. Therefore, it is in its interest to spread itself as much as possible. And if the circumstances are such that it can spread widely all different places, then it will come to a epidemic or pandemic. Now, while going in the body of the host, the body will produce antibodies or cellular immunity or things like that. It is their defense mechanism. The host has to develop all these things to fight the invading organism. But so far as pure virology is concerned, it is not always a, a damaging thing. It can sometimes can be a good thing also. Now people think that a lot of our DNA has been incorporated into our DNA because of the lateral transfer of the genes done by the viruses or microorganisms, and they have added to the gene pool of the genes that human beings or animals have. So it is only when it starts damaging the organism, the host, then it is a problem that takes place. When the nidus is broken, then an epidemic or a pandemic can take place. We have seen such things in many times in the past. For example, in recorded history, the global plague epidemics have created havoc in the 13th, 12th, 10th to 12th centuries in our era. Then among the animals, there has been pan-zoonotic animals in conditions, for example, when the foot and mouth disease virus was introduced in Africa, millions and millions of cattle and animals died in Africa, damaging the livelihood of so many people who depending upon the cattle and their products. So such things are known. Then similarly, in 1915-16, we had the global pandemic of influenza. It started within a small area and then it spread out because it found out a huge number of hosts which have come out of this natural nidus. So we have to think in terms of microorganisms which, and of course different animals, they are different hosts and all over the world. So they are not always damaging to the host, but sometimes when they come out of the system, then they create damages. So it is going to be a continuous or a search and battle thing. Hello? Hello?
Uh, yes, sir. Another person, Mr. Krishnan Verma, had trying to join in. That is why this audio disturbance. You can please continue, Dr. Banerjee.
Yes, sir.
Please.
So,
Thank you.
hello? Yes.
Yeah, please.
So then so we have to think that, see, long time back, Dr. Macfarlane Burnett, a Nobel laureate, thought that we had conquered the infectious diseases by antibiotics. But now we know that how wrong he was. We have not conquered the microorganisms. We have, in fact, given a chance to the microorganisms to proliferate. The drug resistance of tuberculosis, drug resistance of typhoid, and other microorganisms have come out so pointedly to say that the system of genetic changes continues and will evolve, will continue to evolve. And so will the human ingenuity has to continuously evolve its own for its own protection. One thing one must admit that the number of the hosts is a very important factor in the spread of viral diseases or bacterial diseases. if you have got extreme density of people, humans, say in a particular area, the chances of developing a new disease there are higher than other places. So this is as per the, I would say that is a corollary to Pavlovian concept. Hello?
Yes, sir. We can hear you, Dr. Banerjee.
Yes, thank you. So the uh, the total number, the population density is also very important in the spread of this evolution and spread of microbial diseases. How the virus or the organism can spread from one host to the other. This, the more dense they are, the easier they can go. So therefore, if you have to think about the global perspective, you have to think in these terms also. Then the important part is also the transport system. Modern transport system is responsible for transport of people from one place to the other. In India, as you talk about the corona, if it had started originally from Wuhan in China, it did it spread out from Wuhan to China not by direct means in such a short time. It is by the air travel, and such air travel is also responsible for the rapid transmission of organisms or pathogenic organisms. So one has to think about in this. If you are talking about the neighboring countries, and also we'll have to think about in these terms also. You remember that sometime back, the big scare of plague in India, which the plague was not there, but it was a media-made plague. I tried to investigate as intensively as possible, but I did not find any living praise bacillus in the organism, in the host, which were considered to be plague affected. Anyway, but then lots of people had to migrate out from the cities of Surat and Ahmedabad and Pune and all these places. People had to move out. So this is another factor which has to see that the panic factor which comes out of these media made epidemics. I do not blame the media, they have to do their own job, but it is the psychology of the people that they get panicked with some unknown things. So there are so many factors which are involved: mass psychology, mass movement, uh, then if they are moving out, how do they move? Can they can they carry the disease with themselves or like that? So far as the corona is concerned, as I said, that I have never worked with coronavirus, but what I have followed here is that the virus was originally from China, and then it spread out to different places through air. And it was the business of the countries to keep the air traffic under control. They did not do that. On the other hand, they are controlling the poor people's movement, and they are undergoing severe hardships and or inanition. There will be more people died of inanition and movement or walking. People, thousands and thousands of people walking from Surat and Ahmedabad and Bombay to UP and Bihar, all these places. So this is also a very, I would say, not a very management situation, but a rather panic situation. These things needs to be thought about in the future. the, we have a lot of people in the Middle Eastern countries. If something happens to there, will the lakhs and lakhs of Indians will be moving out in no time? That will be another big problem. So, for example, in the time of SARS, that was a warning that also started in Beijing and some other places in China. But it was also a coronavirus disease, the relationship between this coronavirus, COVID-19, and the SARS-2 is about 75 to 80%, the genetic relationship. Similarly, there was a MERS, MERS in the Middle East and in the Syria and Lebanon and in these places, and Saudi Arabia. So that is also a coronavirus. So are we going to think in terms of new group of viruses which are transmitted by air and from human to human than any other previous group of viruses which were transmitted by what I would call insects or water or something like that. Transmission by air is the most efficient system. For example, very few people know that even the smallpox virus was air transmitted. It was done by my senior colleague, Dr. J.K. Sarkar from School of Tropical Medicine. But before that, people did not know much about the method of transmission of smallpox virus, that it was through aerosol route. So the new aerosol route of virus transmission or bacterial transmission will be a new paradigm in the epidemiology of diseases. This is my humble opinion that when I was a long time back, I tried to do a little work on this field. See, we were working with Casanur forest disease virus, and it was a very infectious virus. Anybody who worked for the virus got infected and had to be hospitalized. So I was a little curious how it got infected. People get infected. People get infected by tick bites, all right. But even if they are not bitten by a tick, how do they get infected? Maybe through aerosols. So I started to think about the aerosol business, but I was stopped by the then director that no nonsense playing in this area. So, but later this DARPA, that the USA, they did a lot of work in this field, aerosol route of transmission. What kind of aerosol that things can happen by sneezing and coughing and spraying and this and that. And in fact, the Japanese people have also done a lot of work in this field regarding this aerosol transmission, but most of them is unpublished. So, but the thing is that now we must be concentrating more on the water transmission and air transmission of microorganisms, and particularly from dense areas, population dense areas, where the new chances of new evolution of organisms are high. Thank you, sir.
Thank you so much, Dr. Banerjee, for the very in-depth analysis of the issue, despite your modesty that you haven't directly dealt with the coronavirus as such. So now I would request all the participants to kindly raise hands for your questions, but it will be better off if you kindly send your questions on 2 WhatsApp numbers. I have mentioned it on the chat as well, but just for the convenience of all of us, I'm repeating those WhatsApp numbers. First is 7678220346. I repeat, 7678220346. And the other is 95826 34854. I repeat, 95826 34854. And as we await the questions for Dr. Banerjee to answer, first of all, heartiest thanks from all the participants to Dr. Kalyan Banerjee, and through his talk and through the chats that he was, while he was talking, the information that we have been receiving, apart from the Bhishma Pitama of virology, epidemiology, and immunology and related healthcare issues, we just learned that Dr. Banerjee himself is a living encyclopedia of Indian texts and one of the greatest Sanskrit scholars. Imagine, on one hand, he is expert of virology, epidemiology, and immunology and related issues. And at the same time, Dr. Kalyan Banerjee is also an eminent Sanskrit scholar in his own right. So it's with most modesty, kindly forgive me that I had the audacity to quote one of the shlokas of Gitas. But coming to the webinar, Dr. Banerjee, an obvious question that pops in my mind is, while you refer to, Dr. Banerjee, are you there, sir?
Yes, sir. I'm really hearing you.
Yeah. So you mentioned about that plague issue that the country had faced nearly a decade and a half back. I remember I was
Yes,
a
yes.
cub journalist during News Track. Aztec hadn't started. And we used to go to the airport, and Ghulam Nabi Azad was the civil aviation minister whom I had interviewed when he had landed from Surat to Delhi. So it's very curious that most of the participants would also agree with me that it was a kind of a hoax that you said. It was, the plague never existed in its own right. So is there any analogy of that plague epidemic and overemphasis on its preparations and the present coronavirus epidemic? How much is it for the real, and are we really reacting to it in a proper manner now vis-a-vis that plague epidemic, Dr. Banerjee?
Sir, you have asked a very pertinent question that while handling an epidemic situation, it is the people and their reaction to the epidemic situation is also very important. Medical part is there. Medical people will have to take their own responsibility and their burden of work. But it is also, I am rather reluctant to say that it is the business of the politicians and the media to give a proper perspective of the condition. See, neither overemphasis nor underemphasis. See, in the origin, in the 1985 or 85 or 86 plague epidemic, so-called plague epidemic, see, I personally investigated the cases in Surat and in Mamla in Aurangabad area in Pune, Maharashtra. And I found, literally did not find anything new. The question is that I went to Surat Medical College and asked them, did you isolate anything? Well, yes, we have isolated organisms which look like plague. Well, all right, can you give me these isolations? So they were very kind and gave me 17 isolations. I carried them here. And the first fundamental thing of a plague bacillus is that it is extremely pathogenic to mice. One bacterium is enough to kill a single mouse by multiplication. I collected the specimens, collected, I had previously arranged some mice in my laboratory, freshly bred, without any outer infections, so that they will be free from any other interference, inoculated them, and asked two of my assistants to be present to see the mice if they were falling sick. And the poor fellows, they stayed overnight, and I got early in the morning. First thing, I went to the lab and asked them, what has happened? Nahi, sir, चूहे तो अच्छे हैं.
So that is
then
the
I
reason
looked
why
at
I was wondering, Dr. Banerjee, that it was kind of a hoax. So do you think presently, the present coronavirus, the reaction is more or less genuine, or is it also overrated?
Sir, I cannot say it is overrated or underrated. It is the politicians have done that, and then they have followed up by the media.
Okay,
So it is
Dr.
not for
Banerjee.
me to comment.
Now you are
But
such
the
a
question is,
Ji, please continue.
but the question is that what has happened See, what has happened that if we see that the virus originated from Wuhan, the Chinese people were doing their job reasonably well. I would say reasonably well. They shut down Wuhan, but they did not shut down the whole of China as we have done in this country. Okay,
Exactly, exactly.
so
So,
they shut down Wuhan is fine, but they did not shut down the whole of the China as we have done here. Secondly, we knew that the virus is originating from Wuhan and will be flying to different places. It will not crawl by itself. So what was necessary is to keep the airports absolutely under control. The people coming in the airports from different sources under control. By that time, things were already moving to Italy and Spain and what is this thing called
USA.
Iran also.
जी,
And when it is in Iran, then it has to be a little careful. One has to be very careful. But it is our immediate neighbor where there is a lot of traffic. So,
uh,
hello,
yeah, Dr. Banerjee.
hello.
Dr. Banerjee, can you hear us? Hello.
Yes, I can
Yes.
hear you.
So as we can understand, Dr. Banerjee, though the issue is real and it is serious, but you are hinting that we need our reactions could have been much better. In fact, that was the issue, the main crux of this particular webinar also, that we need to understand from the eminent experts like you how best we could react in future if God forbid anything like that happens. But Dr. Banerjee, kindly be patient because you are such an eminent expert that quite a few questions are also coming your way. And first question that I would like to put to you is from our next guest, Professor Anita Carr.
Yes,
Dr. Yeah, she's asking you, what is
yes,
your, and I quote, what is your opinion about the recent spate of viruses of zoonotic origin? Would you
yes,
think, would you think,
yes,
would you think it is because of environmental and human behavioral changes? Dr.
yes,
Banerjee?
yes, sir. This is a very pertinent question, which I was expecting from a person like Dr. Anita Kar. I know her for many years. She is a very intelligent and a sprightly lady working in the Institute of Health, University of Pune. A lot of these organisms, as I have already told you, that the hypothesis of the Russian epidemiologist that every organism in its own evolutionary scale lives in its own natural nidus or
Uh,
natural
Dr.
circumstance.
Banerjee, Dr.
Sir,
Banerjee, sorry to interrupt you. For the benefit of the audience in general, could you please very briefly tell us about zoonotic origin? What does it mean, the
yes,
zoonotic origin?
yes, zoonotic origin means zoonotic viruses are those organisms which are normally present in animals but also get transmitted to humans.
Okay,
One
sir.
of the common zoonotic, the one what we had worked extensively is the Casanur forest disease from Karnataka. It is essentially a zoonotic disease in the animals and circulated among the monkeys and the rodents and the different small animals in the Karnataka forest. When human beings come into their contact, they're bitten by the ticks, which are transmitters of the virus, and they get infected. So this is a very well-known zoonotic agent that we know now. We have worked extensively. So
Yeah.
zoonotic agents are important ones. Another very important zoonotic agent is the rabies, which is very prominent in this country. It is a virus moves among the dogs. When they are grouped together and they are biting each other like that, and occasionally they bite humans. So that is a zoonotic agent which infects humans.
Yeah, so Dr. Banerjee, the second part of the Professor Kanita Kar's question was, would you think it is because of environmental and human behavioral changes?
Yes, I would not make a categorical statement, but there are certain certain aspects. Certain scientists from Japan. They have said that it is a man-made coronavirus. It is a synthetic virus, this and that. But I cannot subscribe to that. But it could be a zoonotic agent. It could be a virus circulating in animals without doing much damage to them. And when it jumps the barrier, species barrier, it is creating havoc among the humans.
Yes, sir. The next question coming your way is from KM Singh, a retired senior police officer and also a vice president of PPF. His question is, Dr. Banerjee, COVID-19 should be an eye opener to the country about the importance of preparedness. For this, I'll repeat it again, right?
Yes.
The question is, and I quote, COVID-19 should be an eye opener to the country about importance of preparedness. For this, due importance needs to be accorded on research and R&D with adequate funding in PPP mode. What would be your suggestion on this, Dr. Banerjee? What would be your suggestion on this?
Sir, one of the very important question is that what should we do under these circumstances? Okay. In short, it is like that. Short is that now we have got a global surveillance system all over the world. And the WHO, World Health Organization, is in charge of doing these things. So one has to be a little careful. The WHO may respond a little late because they have their own bureaucratic system to deal with. But nothing prevents us from getting direct information from the world, the information gathering about the diseases and all those things, and then get it immediately analyzed and then get prepared for its fighting. Method of transmission and the method of growing within the population. India has got a big advantage and a big disadvantage. Big advantage is the large population. The big disadvantage itself is the large population living in very difficult circumstances. We are talking about what is this thing called social distancing. How is social distancing possible in a 90%, 80% of the people living in 10 by 10 rooms, 6 or 5 of them living in that place, 6 by 8 room or 8 by 8 room? What is that a joke? Social distancing, unless in these circumstances, we have to think of some alternative methods.
Okay, so thank you, Dr. Banerjee. The next question that is there is also from one of our guests who would be joining us tomorrow, who would be our guest tomorrow, Sri Vineet Chaudhary. His question is, and I quoted this question word to word, Dr. Banerjee, what is herd community? Would herd community not develop faster where population concentration is high?
Yes.
Dr. Banerjee?
Yes, that is a, I would say that it is a layman's question. It is not a specialist question. Herd immunity is a very abused concept. Okay. It is true that when an organism is circulating inside a population, it will produce some degree of immunity. Some people will fall sick, and a lot of people will not fall sick. Okay. Yeah. So that is called that we say that is due to herd immunity. But herd immunity is a little different thing from that. See, in India, for example, we have got herd immunity against what is this thing called typhoid. Yeah. See, if you go to any population and take their blood sample, you will find that low titer antibodies against typhoid in a large population of them. But still typhoid cases take place. Why? Similarly, the herd immunity is there, but some people escape the herd immunity and get the infection. And those people who get the infection, they are responsible for spreading the infection among the other people who don't get infected. I mean, they get infected, but they don't fall sick, and that they produce the herd immunity. So, for example, again, in measles, very common, very common example is that till recently, when the measles vaccine program was not a universal program, lot of children used to get measles. Small children, say 2 to 3 years of age. But beyond that, 5 or 6 or 7 or 8 or 9 years of age, the children did not get measles. They said that they are due to herd immunity. Yes, true. But the question is that small children below 3 years of age, they used to get this infection, and they were causing the transmission of the disease among themselves. So, though the herd immunity among the other people were there, these children were accepted, and they used to fall sick. And it is well known that measles in small children is not a very serious disease, but in adults it is a very serious condition. So somewhat it seems like with corona, with old people it is very dangerous, and younger people is not so dangerous.
Okay, sir. So now the question, Dr. Banerjee, is from one of our PPF researchers, Echo Jam, and I'm quoting his question to you. What are the constraints and challenges faced by virologists and epidemiologists in fighting against CDs and NCDs in India?
First, I didn't get the last word. Against?
Fighting against the CDs and CDs and NCDs in India.
Communicable disease. CD? Can you elaborate that?
Yeah, I think he means by communicable diseases and non-communicable diseases.
Right. CDs and
what are
epidemiology. Right. I understand
constraints
that.
And challenges faced by virologists and epidemiologists.
Yes, thank you very much. I understand that now. The communicable diseases and non-communicable diseases are two different groups. They cannot be grouped together at all. Non-communicable diseases like hypertension, diabetes, and other things like similar things like that, they are what I would call age-related, socially related conditions, food-related conditions, lifestyle-related conditions. The communicable diseases are a different group altogether. For the communicable diseases, we have to see what communicable diseases are present and are likely to be present in future. These are the challenges. What are present, we know. For example, we are still fighting with tuberculosis. In India, we still get about 500,000 cases dying of tuberculosis every year. So then we get about 20,000 cases of rabies dying every year. These are the common communicable diseases. Then we still have some typhoid. We still have some occasional cases of outbreaks of gastroenteritis, maybe due to cholera or due to non-cholera organism.
Yes.
We still have outbreaks of Japanese encephalitis, outbreaks of dengue, outbreaks of chikungunya, things like that. Now, the epidemiology of some of these diseases and prevention of some of the diseases are already worked out. I would say we have worked out. But the question is that have they been implemented?
So that means, yeah, the issue and the challenge of policy making, decision making, and implementation is what you are pointing out,
right,
Dr.
Sir.
Banerjee. Yeah,
right, sir.
Now, I guess
it means that the health should be a priority sector in the government, both in the state and in the central government. The health, now understand, in India is essentially a state government subject, but also is a central government subject. Both these governments should, sir?
Dr. Banerjee, that is precisely one of the areas that we are trying to explore in this webinar, the improving, how to improve the center-state cooperation in healthcare, and also with vis-a-vis civil society, including public sector, and
Right.
also the increase of spending in healthcare. That is the idea of this particular webinar.
Right.
And
Right.
related to this, Dr. Banerjee, there is a pertinent question, I think, that's coming your way. It is from Aditya Anshu, one of the participants. And the question is, I quote, how can we encourage private sector to increase the skewed ratio of health workers and infrastructure in rural areas versus urban areas?
Sir, the private sector is entirely under their control. Only the government policies can induce them to take some action in this respect. The government can give tax reliefs to them or some amount of conditions conducive for the such spending. Say, for example, there are some systems that ATCC, ATCCD or something, in which if you donate some money to establish such organizations, you get some tax relief benefit. And there are certain restrictions also. So these type of things have to be streamlined. See, they can establish. The question is that some of these things are already known. They need to be implemented. The implementation part is the weakest part in our country. Though research part is already there, it is also needs to be strengthened. We are not like the Smithsonian Institute, or not like the University, Yale University, or Harvard University, or the CDC of USA. But still, we can afford to spend a lot more money in health research and health delivery research, which is more important. And then controlling the misconceptions among the people. I'll give you an example. Sir,
Dr. Kar, Dr. Kar, can you hear me? Hello?
Hello, yes.
Hi,
Yeah,
yes, I'm very much there.
Yes.
Okay. Dr. Banerjee, can you hear me? Dr.
Yes,
Banerjee?
I can hear you. Yes,
Yeah.
I can hear you.
Yeah, now we are almost through with the time for the first session for our first guest, Dr. Kalyan Banerjee. But on a parting note, there is an observation from the next guest, Professor Anita Kar. So I would like you to respond to that, Dr. Kalyan Banerjee, and then we can move on to the next guest. Professor Anita Kar, yeah, Dr. Banerjee, Professor Anita Kar presents an observation for your comment. She points out that there is already, in all likelihood, community transmission in India in certain pockets. Without any surveillance, we truly do not know the epidemiology of coronavirus in India.
Yes, that is true. What I understand, first of all, I must say that I have not worked with coronaviruses. So my observations are only what I read from the newspapers and from the TVs and this and that. But Dr. Anita Kar's observation needs very serious consideration, that we need to have detailed surveillance system, not only for corona, for all other communicable diseases, and also for the non-communicable diseases also. For example, the incidence of hypertension, incidence of diabetes in the rural areas, we have got very little information that needs to be worked out.
So this is a wonderful point where the first guest of this webinar agrees with the observation of the next guest of the webinar, Professor Anita Kar. So on this note, from all the participants and those guests who have already joined, I would like to thank from the core of my heart, Dr. Banerjee. You've really clarified quite a few things on this particular issue that we are dealing with. in this webinar. Thank you very much, Dr. Banerjee. Please accept.
Thank you, sir. Thank you very much. Thank you very much.
And at